Phone, Judy and Tracy, thank you. Anyone opposed? Hearing none, that is carried. Any announcements of conflict of interest on the agenda as presented to you? Okay, hear none and see none. So we'll move on to the approval of the minutes of the regular board meeting that was scheduled and completed on July 14th. A motion on those minutes.
Judy.
Thank you. Thank you, Judy. Do I support?
Aldo.
Okay, you have to speak up. I didn't get that one.
Aldo.
Thank you all. Thank you, Aldo. Any errors or omission? Hearing none, opposed to the minutes. They're carried. Thank you. This arising, we'll go to 6.1, Board of Health policies. Nicole, if you want to bring that forward.
Yeah, thank you, Mr. Chair. So there is an information report associated with this as well for the board's information. So again, this is part of our ongoing updates and development of policies for the board. I'm going to turn it over to Lori Gregg, our Director of Corporate Services, in a minute, and she'll go through the details. But really, obviously, cybersecurity is a hot topic, and definitely more is being done on our part and more awareness. And so we just thought it was timely to bring something forward to our board, and also in some of our work towards transparency and reporting, you'll see more regular updates from us related to the types of security threats and risks that are that we're experiencing at the health unit, and then obviously as a board, how we what our program looks like and how we mitigate those risks, and what we plan to do on an ongoing basis. So I'll turn over to Lori, and she'll just walk through it for everybody.
Okay, thank you.
Good afternoon, everybody. With the permission of the chair, if I could actually speak to the report and the policy together, I think that they do
Sure.
tie together quite nicely.
Absolutely.
So the WeChew, its programs and services are heavily dependent upon the IT technology that we have. Naturally, this creates risk for cyber activity. To mitigate our risks relating to cyber activity, we need to focus on 4 areas of our program, and that's really our people, our infrastructure, how we transfer risk in the event of loss, and continuous improvement. So from a people perspective, and this is where our cyber awareness program and training policy comes in, we've implemented this policy, which in effect formalizes things that we were already doing as it related to cyber activity. So we had cyber awareness training that we provided to our staff. And there were also simulated phishing attacks that were implemented in our organization. So with this policy, what we've done is, again, we've formalized the training and compliance requirements for all staff and board members. As we consider these, we're all users of the WeChew systems in some manner in our activities with the WeChew. In addition, we formalized the fact that we are, again, acknowledging that we do these phishing campaigns on an annual basis at a minimum, and if not more frequently, as a result of different types of risks within the IT environment. Lastly, the policy serves to formalize the reporting requirements, not only to the management team and leadership team, but also to our staff to increase transparency, awareness, and to create more accountability, and as well to our board to give you an awareness of the training programs and the uptake on those programs, our successful completion as it relates to phishing campaigns, and as well the nature of the activities that our systems have had to combat over the course of a given time frame, whether it's by quarter or throughout the entire year. So the second piece of our cyber, how we approach cyber in our organization, really has to do with our infrastructure. And as you can see in the board report, we have a layered approach to the infrastructure that deals with our intrusion detection, our firewall, our anti-malware, our antivirus in our operating system. And the multi-layered approach, again, helps to mitigate the risk of cyber activity infiltrating our systems. Now, in the unfortunate instance that there is a cyber activity or cyber event that impacts our organization, it's prudent to have insurance to mitigate the financial loss resulting from that. So we do have a third-party insurer, Beasley Group, that covers breach response services, first-party loss coverage, various liability coverage, e-crime, and criminal reward coverage. Lastly, from a continuous improvement perspective, as we are always trying to review our systems to ensure that we have our patches done, look to see what technology, how technology is improved over time. We are endeavoring to do what they call a penetration test. And the penetration test really looks at and measures the vulnerabilities that exist within your IT infrastructure, identifying improvements to be made. So we have engaged a third party to assist with that. Once the penetration test is completed, recommendations will be made, and we will make remediations on account of those recommendations. And there will be an opportunity to retest to make sure that we've mitigated our risk in that regard. Additionally, the penetration test, the third-party consultant will provide training to the leadership team and as well the board members on the work that was completed. Recommendations were made and the end result of all of their work. Are there any questions from the board to the chair?
Just again, I'm sure it's there as well, but when we're on the fishing expeditions, on some of the trial pieces, to all the staff and so forth, that includes every member of the board as well will be in that process, right?
We will be endeavoring to do that. I have to say that we're still working out the complexities of having individuals that are exterior to the organization be part of that, but there will be a further update on that when we have more information. In your iPads tomorrow morning, each of you will have an individualized sheet of paper, the sheet that will show you how to log into our our cyber training. You will all be given access to cyber training, and it's a very, very concise training that all of you will be required to do on an annual basis. So more to follow on that, and you should also have included in that package as well the cyber awareness program training policy for all of you to review.
Perfect. Okay, thank you. Any questions or comments, members of the board? Anyone who wants to, weigh in, either use your raised hand icon or your camera. Okay, no further questions, and a motion then to receive the report from Lori. Thank you, Judy. And is that Fabio?
Gary Kashak.
Oh, Gary Kashak. I'm sorry. Thank you. Oppose? The motion carries. Thank you.
Gary, question to the chair. Did we
Yeah.
skip on the agenda 4.0 COVID update, or is that coming later?
Oh, son of a gun. We did. I did that yesterday at a meeting as well. I think on my my county council meeting. I was in a hurry. I don't know why. Yes, I did, and I do apologize to Dr. Nazatiri. It was a pure oversight and not intentional by no means. Thank you, Judy, for bringing it up, and I'll call upon Dr. Nazatiri to bring us an update on COVID-19. And my update to you, Dr. Nazatiri, I got my 4th shot.
Oh, excellent.
I took your advice.
Excellent. Members of the Board of Health, Board Chair, Mr. McNamara, my colleagues, my colleagues at this meeting today, thank you for allowing me to speak. I wanted to talk today about an important initiative that the Public Health Service is doing, and I'm happy to answer any questions about COVID as well. In short, I think that disease activity province-wide is down. We still have challenges with COVID at the health district. We've had a number of outbreaks at the current time. My concern moving forward is what the challenges we might face in September, October, November, as we also have more people being indoors, and the flu season may add an additional challenge. But today I'd like to talk a little bit about vaccines. So the Public Health Unit works with the legal framework of the Health Protection and Promotion Act and the Immunization for School Pupils Act. This regulatory framework provides the basis for how we operate the Public Health Service. From my estimation, the Immunization for School Pupils Act is a very progressive piece of legislation. And the goal of the act is to advance the health of the community and to advance the safety of children while attending school and beyond into adulthood. As part of the regulatory framework, there are provisions for vaccine reporting and vaccine reporting. Stated another way, the province requires that individuals who attend school report on their status of a polio vaccine, meningitis, whooping cough vaccine, among others. Not all vaccines are covered by this legislative framework or this policy framework, but in many ways, it's an important way to advance the health of young people. So this September, as part of the vaccine verification process, the health district has initiated an effort to get all young people up to speed as it relates to reporting. There's a computer system called the Panorama Computer System, which maintains a vaccine record for virtually every school attending student in this province. That system provides us with a report, and we're able to contact families who have not yet come up to date. And that initial contact was at the end of the last school year. Another letter was communicated during the summer. There'll be phone calls being made to families. And we hope that with this communication that people will become up to date on their vaccines. Now, a number of people have already got the vaccine, and these young people have received it, but their records are not up to date. And so for those people, they'll have to communicate with the Public Health Service to get the records up to date. We're trying to make our best efforts to make that as convenient as possible. There'll be another group of young people who have not come up to date for their vaccines and will require vaccination. Vaccines are available from doctors' offices, nurse practitioner-led clinical services, clinics, and from the Public Health Unit. Up to this point, by September, we anticipate there will be 150 clinics operated by the Public Health Service at a variety of venues to help young people come up to speed. I want to share that it's just not the required vaccines that are important, like the meningitis vaccine, which is very important, but there's also the human papillomavirus vaccine and the hepatitis vaccine, and these vaccines will be offered to young people as well. And something I think we can be proud of in Ontario is that these vaccines are offered without cost to young people. If I could share, vaccination helps the person immunized, but it also helps others. When a person gets their child vaccinated or their young person vaccinated, they're preventing illness in that person, but they're also helping other people. They're helping people who can't be effectively vaccinated because of their health status. Some people cannot get a vaccine because a vaccine might affect their otherwise medical care. So getting vaccinated is not only an affirmation of trying to help your own children, but also an indication of how you can help other people. Now, some health districts have foregone a vaccine verification, and part of vaccine verification is suspension of young people from schools who are not up to date or who have not made the reporting requirements. I want to share that suspension is the last thing that we want at the Public Health Service. We want people to come up to speed, and we want young people to come up to date because we want to help them in the transition from school into adulthood. At the current time, we want to keep schools as safe as possible. We want to keep young people protected, and we want them to emerge and join adulthood as best protected as possible. And in this context, I ask for your support and the community's support in the Public Health Services efforts to bring all young people up to date on their vaccination. Thank you, and I'm happy to answer any questions.
All right, thank you for the summation, Dr. Nazatiri. Any questions or follow-ups from members of the board to our medical officer?
Yeah, Judy, I have a question.
Go ahead, Judy.
So thank you, Dr. Nazatiri. Two questions. So COVID is still not a required vaccine? Is that correct?
That is correct. At the current time, it's not a vaccine that reporting is required under the statute. Nevertheless, it's that from my perspective, if you are eligible for the vaccine, you should get the vaccine. I think it helps you and it'll help others. Secondly, I think that if when it relates to children, especially children, to have the dialogue with your family physician or your nurse practitioner, and the health unit encourages people to come up to speed. I would share that overall the health status of the people of Windsor-Essex was lower as a community, and Windsor-Essex has suffered disproportionately from COVID-19. We have approximately 650 deaths. The week before last, we had 6 deaths in 1 week. So I think that the pandemic is not over. We have to face and manage the burden of COVID, but we also have to manage other diseases of public health significance. I'm sorry for that long-winded response, but thank you for letting me speak to it.
Thank you. I know that we put a motion to the province earlier, this along with other health units, and so we've heard nothing back, I guess, to the chair and Nicole. So the other question that I have is, can you update us on expectations for monkeypox vaccine? I hear they're starting some of them in the States and wondering, while it still seems relatively low, so did COVID before it moved very quickly. And this one does seem more contagious. So wondering what our expectations with vaccines and for that virus.
Sure. We have around 400 or so monkeypox cases, and we can get the epidemiologist to give the exact number across the province. The community of people that are currently affected are individuals who are intersex with men. Anyone can get monkeypox, but right in Africa, it affects a broader group of community.
Somebody's not happy.
I'm sorry, Mr. McNamara.
No, I'm just if it's somebody's not on mute, they should mute your so that there's no interruption. So sorry about that, Dr. Nazatiri.
No, thank you. Vaccine is available and it's offered to at the current time to two groups in our community. One is that there's people that are contacts, meaning that they've come in contact with someone with established monkeypox, and we take an approach where we vaccinate people after they've been exposed. It's post-exposure prophylaxis or post-exposure vaccine. That's been offered, and that will continue to be offered. And then there's pre-exposure prophylaxis, which is that for individuals that might be at higher risk of contracting monkeypox, that they would be offered the vaccine prior to any potential exposure, or with the hope that we reach those individuals prior to the level of exposure. Now, this past weekend, there was a pre-exposure clinic or pre-exposure program that was incorporated into the Pride festivities, and my colleague Felicia can comment further, but I think approximately 100 individuals availed themselves of that opportunity. I think moving forward, the health district would offer and continue to offer pre-exposure prophylaxis, so long as vaccine supply remains available to the health district, and we continue to advocate that as our current public health policy. Does that answer the question? If not, I'm happy to share additional comments.
That's good. I guess I'm just wondering, is it something where the general population at this point should be expecting that expecting to be looking to be getting vaccinated, or it's still very early, somewhat contained, and it's more, again, as you're doing post and pre-exposure to specific groups?
Yeah, so nothing in medicine is 100% or to predict the future, and I didn't think COVID would be as I was going to use the word disruptive, but clearly a perturbation to our clinical services paradigm. I don't think at this point widespread community vaccination is the strategy. At the current time, it seems that the highest risk community are men having sex with men, and the level of transmission is the basis of transmission is skin-to-skin contact. So when individuals have a particular sore or lesion, that they might be able to transmit that to somebody else. And given that context, I don't think that at this point widespread vaccination would be the best policy. Now that might change as we gather more information or the disease presentation changes. But at this point, I wouldn't recommend pre-exposure prophylaxis, which is basically vaccinating an individual like we vaccinate for other disease states or other conditions. I don't think that's something that we should move forward with at the current time. The other issue is that when one does vaccination, you also have to have a readily available stock of vaccine. And I think we have to be cautious in using the vaccine that we have in the most efficient way to help as many people who might be at risk.
Okay, thank you. And thank you, Chair, and apologies. I think that was my dog trying to be Cujo, and I didn't get my mute off fast enough after I asked the question. So apologies, Dr. Nisatiri.
No, that's okay. Not a problem. Any further questions or comments at this time? If not, then thank you, Dr. Nisatiri, and then I'll ask for a motion to receive the verbal report that Dr. Nisatiri brought forward. Judy, thank you. And do I support?
Seconded, Reno.
Thank you, Reno. Any opposed? Then the motion carries. Thank you. So we dealt with 6 and 7 on the presentation that Lori made, and that was duly done. We do not have any resolutions or recommendations at this stage here. I don't believe we have any new business, but I'll ask if there's any new business that members of the board or certainly administration want to bring forward at this time. Okay, then if I could have a motion to move into the committee of the whole under Section 239 of the Municipal Act. Mark, thank you. And do I have support?
Support from Fabio.
Thanks, Fab. All in favor? Opposed? Carried. Leanne, we'll give you a few minutes and let me know when we're clear to go.
Yes, one moment, please.